The number one question I get from women online and in my clinic is this: Doctor, is there anything I can do to feel more confident about my body? Sometimes it's phrased as, how do I feel more desirable? Or, is there a way to enhance my intimate experience? And I get it. This is a deeply personal topic. But here's what I want you to know. You are not alone in thinking about this. A massive international survey found that more than half of women were unhappy with aspects of their intimate anatomy or sexual confidence. But here's the twist. When their partners were asked, the vast majority said they were satisfied and deeply attracted to their partners just as they are. That gap between how we feel about ourselves and how our partners actually see us is real. And it matters because this isn't just about physical appearance. It's about confidence, intimacy, and dignity. Before I unpack the science, do me a quick favor. Hit the like button if you value honest, no-nonsense health talk. Drop a comment and tell me, where are you watching from today? And of course, subscribe to this channel because every week I share new science-backed strategies for women's health, intimacy, and vitality. Let's start by busting one of the biggest myths out there. Media, social platforms, and even intimate product marketing have completely distorted our sense of what's normal. What you see on screen or in ads is not reality. It's performance, often altered by filters, surgery, or unrealistic standards. The real-world, medically measured truth is this: there is an enormous range of normal when it comes to female anatomy. Labia size, clitoral hood shape, vaginal depth, vulvar color, all of these vary widely, and all are completely healthy. Here's another fact. True anatomical conditions that require medical intervention are extremely rare. Most women who worry about their bodies aren't really struggling with a medical issue. They're struggling with anxiety about their bodies. It's so common that doctors actually have a name for it: genital self-image concerns. And here's why that matters. Because the more you obsess, the worse it can affect your mental health, your relationships, and even your ability to experience pleasure. Hi, I'm Dr. Mariana, a board-certified urologist and women's health specialist. I've been helping women protect their health, restore their vitality, and improve intimacy for over 12 years. And part of my job is separating science from hype. Today I'm going to break down what the medical research really says about intimate confidence, body image, and enhancement treatments. We'll cover the real facts and why they matter, the mistakes women make chasing risky or fake fixes, and yes, the few scientifically tested methods that can make a measurable difference in how you feel. I'll also share what I tell women in my practice who come to me worried about this exact issue. Let's go through the most common approaches women try, from the least helpful to the ones with actual science behind them. Mistake number 1: falling for scams and quick fixes. Everywhere online, you'll see ads for miracle creams, pills, or shady procedures. They promise dramatic changes in sensation, tightness, or appearance. But here's the truth. There is zero clinical evidence that pills or lotions can fundamentally alter your anatomy or dramatically enhance pleasure on their own. Biologically, here's why. A cream cannot penetrate deeply enough to alter muscle tone, tissue structure, or nerve sensitivity in any permanent way. Pills marketed for enhancement usually just contain herbs that mildly increase blood flow, at best giving you slightly better circulation, not a transformation. And emotionally, falling into these traps sets you up for disappointment, wasted money, and sometimes dangerous side effects. Mistake number 2: ignoring the mental side, body image anxiety. I want you to pause and ask yourself, am I chasing physical change or am I chasing confidence? Because studies show that when women with body image concerns receive psychological counseling without any physical treatment, most of them stop feeling the need for enhancement at all. That's powerful. Think about it. If your partner is already satisfied and attracted to you, the real victory might be learning to see yourself through their eyes. Biologically, your body isn't broken. Emotionally, the anxiety convinces you otherwise. And practically, investing in therapy could save you years of stress, money, and risk. Option number 3: pelvic floor therapy, the gold standard. Now we're getting into the only non-surgical treatment with consistent scientific evidence for improving intimate function and confidence. Pelvic floor physical therapy involves targeted exercises that strengthen the muscles supporting your bladder, uterus, and rectum. In clinical studies, women who committed to pelvic floor therapy experienced improved orgasmic function, better bladder control, enhanced sensation during intimacy, reduced pain during intercourse, greater overall confidence. But here's the trade-off. It requires consistent practice over weeks or months. Side effects are virtually non-existent when done properly with guidance, and the gains are real, not the dramatic overnight changes ads promise, but genuine, lasting improvement. Biologically, it works by strengthening and coordinating muscle function. Emotionally, you gain a sense of control and connection with your own body. Practically, it means doing targeted exercises daily, often with the guidance of a trained pelvic floor therapist. Option number 4, lubricants and moisturizers, underrated and essential. This is one of the most overlooked yet powerful tools women have. Quality lubricants and vaginal moisturizers don't just reduce discomfort, they can genuinely enhance pleasure and confidence. The truth: proper lubrication is not a sign of inadequacy. It's a tool for optimization. Hormonal changes, medications, stress, and even hydration levels affect natural lubrication. Using high-quality, body-safe products is not cheating. It's intelligent self-care. If anyone tells you that natural is the only acceptable way, walk away. Medical-grade lubricants and moisturizers are designed to work with your body, not against it. Mistake number 5. Dangerous procedures and unregulated treatments. This is the darkest corner of the enhancement world. Some clinics, and even unlicensed providers, offer injections, laser treatments, or cosmetic surgeries for the vulva or vagina. The risks: tissue scarring, chronic pain, loss of sensation, even permanent deformity. Procedures like labiaplasty, vaginal rejuvenation lasers, or G-spot injections. They may promise dramatic results, but complications are high, and patient satisfaction is often low over time. Bottom line: unless you have a true medical condition causing pain or dysfunction, cosmetic genital surgery is not recommended. The risks far outweigh the psychological benefits for most women. So, what do I actually recommend to my patients? Get the facts. Understand what's normal. Visit reputable medical sources or speak with a healthcare provider. And remember the surveys. Your partner is likely more satisfied than you think. Address anxiety first. Consider counseling or body image therapy, because confidence is often the real missing piece. If you want a physical option, pelvic floor therapy has the best evidence. Just know it's a gradual, patient process, not an overnight transformation. Focus on what you can control right now. Optimizing blood flow through exercise and nutrition. Managing hormones and stress. Using quality lubricants and moisturizers. Improving overall sexual health through communication and exploration. Because here's the truth: most partners care less about physical perfection and far more about energy, confidence, and intimacy. Listen, my friend, your worth is not measured by comparison to others or by unrealistic standards. Your partner doesn't see you the way you see yourself in the mirror. And science shows us that women who focus on overall health, confidence, and connection have far more fulfilling intimate lives than women who obsess over appearance. So if you're worried, don't carry that burden in silence. Talk to your doctor, talk to a counselor, and remember, your body is not broken. At the end of the day, you don't need to chase risky procedures or empty promises. Small, smart, evidence-based steps like pelvic floor therapy, proper lubrication, stress management, and addressing anxiety can make a bigger difference than you think. And the real key to satisfaction? It's not physical perfection. It's confidence, intimacy, and showing up fully present. So, take care of yourself, respect your body, and know that your best years of vitality and intimacy are not behind you. They can be ahead of you. If this video helped, please hit that like button so more women can find this information. Comment below. I'd love to hear your thoughts. And subscribe to this channel, Dr. Mariana, Women's Health, for weekly science-based tips to help you thrive at every age. Until next time, I'm Dr. Mariana, reminding you, Your value as a woman is so much bigger than any single physical trait. Take care of yourself because you're worth it.